I'm Dr. Lee. In this lesson, we'll continue with the study of acupoints, about specific points and methods of locating acupoints. In 14 meridian points, some of them are named as specific points because they have some specific function and treatment purpose in addition to the common properties. Specific points are the most commonly used group of points in acupuncture clinic practice. First, we introduce the concept of the specific points. Specific points refer to those points that have special therapeutic properties. They have their special names given after their indications and functions. According to the classification and properties of specific points, there are 10 categories of these points. 5 sub-points refer a collective name of the 5 specific points, namely Jing well, Yin prey, Shu stream, Jing river, and He sea. They are located below the elbow or knee on the 12 regular meridians. They are situated from distal ends of the extremities to iod or knee. Ancient doctors gave the names of the 5 sub-points in analogy between the qi flow in meridian and the flow of water in the natural to illustrate the origin and the direction of qi flow and the depth of region where meridian qi passed by and their different functions. Yuan primary points. Yuan means origin. The primary qi. Yuan primary point is the site where Yuan primary qi of Zangfu organs passes and stays. Each of the 12 regular meridians has a Yuan primary point on leads, also termed 12 Yuan primary points. In the yin meridians, Yuan primary points overlap with Shu stream points of the 5 sub-points. Each yang meridian, however, has its Yuan primary point over the Shu stream points, which are arranged behind the Shu stream points. Luo means connecting. Each of the 12 regular meridians has a collateral on leads. The point on each collateral is named Luo connecting point, which links its exterior interior related yin and yang meridians. Luo connecting points of the 12 regular meridians are located below elbow or knee joints. Jiwei, the Luo connecting points of the conception vessel situated in abdomen region. Changqiang, the Luo connection point of the governor vessel in sacrococcygeal region. Dabao, the Luo connection point of the major collateral of the spleen in hypochondriac region. There are altogether 15 points, which are termed the 15 Luo connecting points. C cleft point. C means cleft. C cleft point is the site where qi or meridian is deeply conversed. Each of the 12 regular meridians and the 4 extra meridians, such as inhale vessel, and young heel vessel. In-link vessel, young link vessel has a C-cleft point, amounting to 16 in all. They are distributed below elbow and knees. Backshoe points are corresponding points on the back where qi or the respective zangfu organs is infused. Front move points are these on the chest and the abdomen where qi of the respective zangfu organs is infused and converged. Both back fu points and front move points are distributed over the shank and closely related with zangfu organs. The lower He points refer to 6 points of the 3 yang meridians of hand and foot, where downward flowing qi of the 6 fu organs along the 3 yang meridians of foot. Most of them are distributed among the knee joints. 8. Influential points. Hui means join together. 8 influential points are the 8 points where vital essence and energy of zhang organs, fu organs, qi, blood, tender, vessel, bone, and marrow, they are distributed over the trunk and the leaves. 8 confluent points refer to the 8 points where 8 extra meridians communicate with the 12 regular meridians. They are distributed on the areas superior and inferior to rest joint and angle joints. Crossing points. Crossing points are those at the intersection of 2 or more meridians. Most of them are distributed on the hand and side. Okay, the classification and the importance of acupoints are known. How do you find the acupoints? In this section, we will learn how to find them. Locating acupoints accurately is very important for the therapeutic results. In order to locate acupoints precisely, and acupuncturists must grasp the methods of locating acupoints. There are mainly 4 methods of locating acupoints, including bone length measurement, anatomical landmarks, finger measurement, and simple measurement. The first, bone length. Bone length measurement. This is also called bone positional chun. It is a method of locating acupoints in which the bone segments are taken as measurement markers to measure the width or length of the various portions of the body. The measurements are converted proportionately into definite numbers of inco units as the standards. These standards are applicable on any patient of different gender, age, and body size. The body is usually divided into 5 parts. They are head, chest and abdomen, back, up limbs, and lower limbs. Standard for bone length measurements are as follows. The second method is anatomical landmarks. This method is based on the body surface landmarks. The landmarks can be divided into two types. The one, fixed landmarks. Fixed landmarks are those parts formed by eminence or depression consisting of bone, joints, and muscles. The contour of 5 sense organs, hairline, fingers, nails, nipple, and umbilicus. Movable landmark refer to spaces. Depressions, wrinkles that appear while joints, muscles, skin, and other move voluntarily. Next one, finger measurement. The length and the width of the patient's finger are taken as a standard for point location. The following 3 methods are commonly used in clinical practice. First, middle finger measurement. When patient's middle finger is flexed and distance between 2 medial ends of crease of the interphalangeal joints is taken as 1 chun. Thumb measurement. The width of interphalangeal joints of the patient's thumb is taken as 1 chun. For finger measurement, close the 4 fingers together at the level of dorsal skin crease. The width of the proximal interphalangeal joints of the middle fingers is taken as 3 chun. The last one, simple measurement. There are simple methods of point location applied in clinical practice. For example, to locate feng shi as the tap of the middle finger when at attention, or when the index finger and thumb of both hands are crossed with the index finger of one hand stretching. 列缺 is in the place right under the tap of the index finger. Okay, this class is over. Thank you. See you next time.